How do doctors diagnose bacterial vaginosis? When it comes to diagnosing bacterial vaginosis, doctors relying on a combination of clinical evaluation and laboratory testing. This ensures that they accurately identify the condition and provide the right treatment. The two primary methods used are the Amsel criteria and the Nugent scoring system. The Amsel criteria is a straightforward clinical method. For a diagnosis, at least 3 out of 4 specific signs must be present. First, there should be a thin, milky vaginal discharge that coats the vaginal walls. Second, a microscopic examination should reveal clue cells, which are vaginal cells that have bacteria on their surface. Third, the vaginal fluid's pH level needs to be greater than 4.5, which can be checked using a simple pH strip. Lastly, a fishy odor from the discharge, particularly after adding a solution of potassium hydroxide, is also a key indicator. This method is quick and can be performed in an outpatient setting with just a vaginal swab and a microscope. On the other hand, the Nugent scoring system is a laboratory method considered the gold standard for diagnosing bacterial vaginosis. It involves taking a vaginal smear and performing gram staining to analyze the bacterial composition. The presence and quantity of different types of bacteria are scored. Healthy vaginal microbiota is indicated by the presence of lactobacilli, which are long gram-positive rods. In contrast, Gardnerella vaginalis, Bacteroid species, and Mobiluncus species, which are associated with bacterial vaginosis, are smaller and vary in shape. A Nugent score ranging from 0 to 3 indicates normal microbiota, 4 to 6 is considered intermediate, and a score of 7 to 10 confirms bacterial vaginosis. In addition to these methods, doctors may perform a pelvic exam. This involves the doctor examining the vagina and pelvic organs by inserting gloved fingers into the vagina while pressing on the abdomen. This helps identify any signs of infection or other abnormalities. A thorough medical history is also important, as doctors will ask about previous vaginal infections or sexually transmitted infections. Emerging molecular tests can detect and quantify multiple bacteria associated with bacterial vaginosis, but these are not yet standard diagnostic tools. In summary, diagnosing bacterial vaginosis involves assessing symptoms, conducting a physical examination, and performing microscopic evaluations along with pH testing. These methods help ensure that bacterial vaginosis is accurately identified, which is crucial for guiding appropriate treatment and management in the context of sexual health and sexually transmitted diseases. Always remember, if you have concerns about your health, it is best to consult a healthcare professional for personalized advice.